Good evening, good afternoon, and good morning. This is the 2096th day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Dr. Hubert D. Silva. Let us begin the session with 1 minute silent prayer. Thank you all. The International Forum for Promoting Homeopathy comprises of homeopathic lovers, students, and doctors. And we have 3 sessions every day. The first session of the day is already over in Hindi from 7:30 to 8:30. From 8:30 to 9:30, we have the international session in English. And from 9:30 to 10:30, we have a local language session in Malayalam. We are uploading the videos of the same on the very next day itself so that those who miss the session can watch it again. You can subscribe the same without paying any money. You can share it with anyone who loves homeopathy. And so far, we have uploaded more than 3,650 videos. And hope those who missed the session or those who want to watch it again, you can subscribe IFBH Homeopathy at YouTube and you can watch it from there. So let me come to today's guest. Today's guest is none other than Dr. Hubert D. Silva. As you all know, that Dr. Hubert Silva is one of the backbone of IFBH, and he is the person who is uploading the videos of IFBH programs, and he is an artist by profession also because he is doing lot of musical album, and he has prepared a musical album for homeopathy, and that is having a big hit and big followers here. And Doctor has completed BHMS and MS is psychology and is a consultant physician at the homeopathy clinic at Trivandrum, Kerala. And doctor has presented so many presentations in this. And one of the person who has made lot of number of maximum number of presentation. And today, doctor will be talking about some of his knowledge about the neurological diseases, management of neurological diseases with homeopathy. That too, on the 10th edition. That is the 10th part. So we proudly welcome our guest and faculty, Dr. Hubert D. Silva. Welcome.
Thank you very much, Doctor. Good evening to all. Today, Dr. Dhanay told that there are 3,600 and something videos. Now there are 3,750. We are approaching to 4,000. Thank you, Doctor. Today, I think that this is the 11th neurology 11th. Let me share the screen. Please make me a co-host. In the scriptures, 1 Kings 3:7, a great king, the wisest person, Solomon, once he done some 100 offerings. After that, God appeared to him in a dream and asked God, what do you want? What I want to do for you? Ask me. That time, King Solomon said, "Oh Lord God, you have let me succeed my father as king. Even though I am very young and don't know how to rule, here I am among the people you have chosen to be your own. A people who are so many that they cannot be counted. So give me the wisdom I need to rule your people with justice and to know the difference between good and evil. Otherwise, how would I ever be able to rule this great people of yours?" The Lord was pleased that Solomon had asked for this. And so he said to him, "Because you have asked for the wisdom to rule justly, instead of long life for yourself or riches or the death of your enemies, I will do what you have asked. I will give you more wisdom and understanding than anyone else has ever had before or will ever have again. I will give you what you have not asked for. For all life you will have wealth and honor more than that of any other king. Here we can see that Lord appeared to him, God appeared to him and asked, what do you want? That time Solomon asked, only wisdom. I need only wisdom, nothing, any other thing. Because he was at the age of 12, he became the king of Israel. At the age of 12. That time he was a child. A 12-year child, how can rule a big country? But God given him wisdom and all. We might have studied in our small classes. Once King Solomon was ruling, that time 2 prostitutes came to his kingdom, the court, and asked, they both are claiming that a child that is hers. Each one is, they two are prostitutes, they were living together and they have 2 children, one for each lady. That time, one child was dead. That time, the original mother of the dead child taken the live child to her, and put the dead child to the other lady. That time, they both came to the King Solomon and asked, I have the child, both are claiming. That time, King Solomon said that, bring a sword and cut into 2 equal pieces and give to two of them. That time, the original mother of the child told that, the other lady told that, yes, cut into 2 and give me 1 piece. But the original mother told that, don't kill the child, give her. I don't have the child, take her. That time, king understand, the courtyard all understood that the original lady does not want to kill her child. That was his wisdom. Whenever we, in our hospital clinic, patients are coming to us, we should have wisdom. Otherwise, we cannot, even though we have much knowledge in everything, but it is guided by Lord. We have a soul. We could understand the child, the patient. That is what Hahnemann said, that what is to be cured in a person. While seeing the person, seeing the patient, we should understand that what is to be cured in that patient. Let us go to, last time we were going through optic nerve, olfactory nerve, and now this is the 3rd time. Third, we are going to study the oculomotor, the 3rd cervical nerve, 3rd oculomotor nerve. All eye muscles except those supplied by optic. Here, before going to that, we know that our brain has so many faculties, so many functional areas are there. But one thing is very much important. We might have heard about corpus callosum. After going to this, we can go to the other class. Okay? Just a minute. I want to.
In this tutorial, we will be talking about the gross anatomy of the corpus callosum. By introduction, the white matter of the brain consists of association fibers, commissural fibers, and projection fibers. Corpus callosum is the largest of the commissure group of fibers. It lies deep to the median longitudinal fissure that connects the left and right hemisphere together. It is also very important to note that the corpus callosum is C in shape and 10 centimeters in length. Next, we will be talking about other parts of the corpus callosum. Corpus callosum has 4 parts, which are splenium, trunk, genu, and rostrum. Splenium is the posterior bulbous part of the corpus callosum. The central part of the corpus callosum is the trunk. The genu is the anterior part, while the rostrum is simply an extension of the genu to the upper end of lamina terminalis. Let's quickly talk about some of the structures that can be found around the corpus callosum. Superiorly, there is a thin membranous layer of gray matter covering the corpus callosum. This is called the indusium griseum. Posteriorly, transverse fissure separates the splenium from the superior colliculi and pineal gland. It gives passage to the telechoroideo of third and lateral ventricles. The anterior and superior aspects of the corpus callosum are closely related to the anterior cerebral vessels. On the inferior aspect, it gives attachment to the septum pellucidum anteriorly and the fornix posteriorly. The rostrum and genu form the boundary of anterior horn, while the trunk forms the roof of the central part of lateral ventricle. The fibers from the corpus callosum connects with corresponding parts of the cerebral hemispheres. Blood supply is by anterior cerebral arteries and posterior cerebral arteries. Applied anatomy. Callosal.
Can you see?
Yes.
Now this is corpus callosum. We are very much, this is an important part of our brain. The corpus callosum is the largest white matter structure in the human brain, consisting of over 200 million nerve fibers. It acts as a massive communication bridge connecting the left and right cerebral hemispheres to allow them to coordinate sensory, motor, and cognitive functions. So, we have 2 cerebral hemispheres are there in our brain. It should always have some connections. We know that one side of the brain is affected. If the left is working, that the motor area of the right side will be work. Whenever we have to raise our right hand, the left side of the brain must work. This is how always are coordinated each other. If there is any coordination loss, then it is not able to do, the connections is disrupted. That time, there are so many problems will happen. We don't have think, even we don't have drive. Because all of a sudden, we have to, all these parts should be worked and the coordination should be always there. Otherwise, we cannot make. So, corpus callosum is one of the important part of our brain that leads us to do a normal life. We know that here, if the corpus callosum is damaged, missing, or surgically severed, the brain hemisphere struggle to communicate, leading to issues with visual perception, speech, and physical coordination. Notable conditions include corpus callosum agencies, a congenital condition where a person is born with partially or completely missing corpus callosum. Split brain syndrome, often resulting from a corpus callosotomy. This is a surgery doing for sometimes in certain type of this epilepsy. And so we must always have some coordination problems. We might have seen in some coordination problem, that may lead to our life will be miserable. It may sometimes a portion of that is saying that doctors are saying that scientists are saying that once in 400 people have this problem. But some extent, everybody having some problem may be there. That time our condition will be lessened. Our functioning will be lessened. And our, so we are normally, we are not giving much importance to the corpus callosum in our studies. But nowadays we are, more doctors are studying and learning that the functions of the corpus callosum. Its core purpose is to allow the two halves of our brain to seamlessly communicate and share information. This integration is critical for sensory processing, combining what you see, hear, and feel from both sides of our body. If we think, we know that one part of it collect things, perceive things to our brain, thought processing coming, that the other part of the brain, it may do the other things. If we are thinking anything, that time what we do, we have to make it in active position. So action will not be possible if the coordination is not. Some students are studying more, but they don't have the communication skills. These communication skills are mainly from corpus callosum, communicating skills. So motor coordination, other thing, motor coordination, synchronizing complex physical activities that require both sides of the body, riding a bike or typing or cycling or driving a car. These are all only possible if the corpus callosum is functioning normally. Supporting memory. We may have sometimes we have some good memory, but in the application mind, if the memory is, the corpus callosum has any problem, the reasoning, attention, and advanced language processing by enabling the logical brain, left brain, and creative right brain to work together simultaneously. This is very much needed. So now we know that whenever we are learning our materia medica, we might have seen that there are so many conditions are there. The coordination problem, students having to know, but they are studying a lot, but in the application mind, they cannot use it. In mathematics, especially in mathematics, we know that anacardium, zirconium, causticum, stramonium, and hyoscyamus. These are some of the medicines which are very much useful in treating this condition. If the corpus callosum is damaged, missing or surgically served, what happens when your corpus callosum is damaged? Corpus callosum damage affects rehabilitation process. Damage to the corpus callosum, the thick band of nerve fibers connecting the brain, left and right hemispheres, prevents the two sides from sharing information. This leads to split brain syndrome. This is a condition called split brain syndrome, causing severe motor coordination issues, sensory processes deficits, and difficulties performing complex tasks that require both sides of the body. Whenever the age is coming more and more older, that time the coordination of the motor coordination will be, we know that will happen. That time where we may think that some nerve problem, other problems, they might have misguided. But in cases, we had to learn, we had to watch what is the condition of his corpus callosum. This is we can see that. Now let us go to our oculomotor nerve, the third cervical nerve, oculomotor. Can you see it? Hello? Hello? I cannot see you.
Yes, doctor, we can see.
Okay,
We can see.
Here,
Yes, we can see.
this, we are coming to oculomotor nerve. Last time we gone through optic nerve, olfactory nerve, and this is the time that oculomotor nerve. From here starts. Main action is to the eyes and eyes muscles. Starting from here, base of the brain. Here is we know that this is the cervical nerve area. The damage of these parts are general symptoms may have. A person have eye loss, eye vision, olfactory, and everything. You know that here we can see oculomotor nerve is coming from here. The nerve originates from the oculomotor nucleus in the midbrain, part of the brainstem. From there, it passes through the cavernous sinus and enters the bony eye socket through the superior orbital fissure, where it divides into superior and inferior branches. Two branches are there. The oculomotor nerve, cranial nerve, is the third pair of cranial nerves. It controls the majority of eye movements, pupil constriction, and eyelid in elevation. Damage to this nerve leads to third nerve palsy, caused double vision, a dropping eyelid, ptosis, and dilated pupil. Normally, after 40 years of age, oculomotor nerve damages may happen. You know that? These are the conditions. We know that we should have the eye muscles proper. If the eye muscles are not in a equilibrium, we can say that equilibrium, the functioning, whenever we are rolling our eyes, we can understand that. Whenever we are rolling our eyes, some part, it will not be possible for us to reach there. The rolling cannot be done in a smooth way. And again, when in the clockwise direction and the anti-clockwise direction, we have to roll our eyes like this. But it is not possible. Sometimes there is some hindrance we can feel. The eye will not reach the exact corner of each corner. That time, we can understand that there is oculomotor nerve complaints. And another one is double vision. Normally, we can see like this. Our both eyes will concentrate the object. ABC, normal vision, we can see that ABC. Or anything, any object we can see. The both eyes will focus on the object. But it is not possible in diplopia or double vision. That time, the muscles are not properly focusing the object. That time, one eye see here, the other eye see the object. That time, there is a blur, double vision and a blurred feeling we can see. We cannot see it properly, clearly we cannot see. That is one of the main reasons for oculomotor nerve problem. What does the oculomotor nerve do? The oculomotor nerve is one of the 3 cranial nerve pairs that play a role in eye movement. And the oculomotor nerve does the most out of all 3. 7 different muscles and around each eye rely on the oculomotor nerve for the signals that tell them what to do. 7 different muscles in and around each eye. 7 muscles may be affected if the oculomotor nerve is. From the oculomotor nerve, the signals, it may act. The oculomotor nerve lets you the following. 1, open your eyes. You can open your eyes with the help of oculomotor nerve. Rotate your eyeballs up and down. Rotate your eyeballs inward towards your nose. Look to the here. Rotate an eye upward, and when the eye is also pointed inward. Upward and inward. Focus your eyes at different distances using the ciliary muscles to adjust the lens shape. Ciliary muscles are arranging the shape, adjust the lens to focus. It is not possible if the oculomotor nerve is affected. First, open your eyes. For opening and closing your eyes, we should do and check whether there is any problem with our eye oculomotor nerve. Rotate your eyeballs up and down. Rotate your eyeballs upward towards your nose. Rotate an eye upward when the eye is also pointed inward. Focus your eyes at different distances using ciliary muscles to adjust the lens shape. We have to check all this. Whenever a patient comes to our clinic, we have to check. If they say that some blurred vision or double vision, that time we must tell them to rotate their eyes and the movements. I told these movements we must make them do. Its branches connect the muscles on multiple sides of your eyeballs, delivering movement commands from your brain to those muscles. Smooth pursuit. This lets your eyes smoothly follow moving. Pupillary light reflex. When your eyes adjust to sudden light changes, your oculomotor nerve is the muscle doing the reacting. Signals traveling through your optic nerves tell your brain when it is too bright to dim or dim. Your brain tells your oculomotor nerve to adjust your pupil wide accordingly. We know that pupillary light reflex is the main checking for a person is whether he is dead or not. The muscles, if the pupillary reflex is lost, then only we can say that that man is dead. So, whenever somebody may ask you whether the person is dead or not, I have experienced that one person, they told me that he's dead, but I checked his pupillary light reflex and I saw that a slight movement. So I told them that he's not dead. After that, he lived 1 month. Vestibular reflex. This reflex combines your vestibular system, which controls balance, with head and eye muscle. Movements to keep your gaze steady when you are experiencing sharp movements or direction changes. We know that a case, we know Mania's disease is the eye balance, the ear balance. And that time, sudden vertigo will come and suddenly vertigo will, they cannot tolerate, they cannot stand. That time immediate accident may happen whenever they are riding a carriage, in a carriage or like motorbike or anything like that. When they are walking, immediately when they are rising from bed, that time severe vertigo may have in Mania's disease. In that condition, what are the medicines? There are some medicines which helps a lot. Sudden vertigo and Mania's disease. In ear balance. Chenopodium, mother tincture. And another medicines are pulsatilla and gelsemium, spigelia, other medicines, main medicines we can use. And at the same time, we can use gelsemium and natrum also. Diplopia. Diplopia, commonly known as double vision, is the simultaneous perception of the two images of a single object. Only we will get a single object, we should perceive it through our both eyes. The images may appear side by side on top of one another or diagonally. It is categorized into two main types based on its presence. Last time I show you. In mental conditions, in some mental conditions, absent-mindedness is a mental state wherein a person is forgetfully inattentive. It is the opposite mental state of mindfulness. Absent-mindedness. These are all, we can interconnect it, both. Absent-mindedness is often caused by things such as boredom, sleepiness, rumination, distraction, or preoccupation with one's own internal monologue. When experiencing absent-mindedness, people exhibit symptoms or signs of memory lapses and weak recollection of recent events. Absent-mindedness can usually be a result of a variety of other conditions often diagnosed by clinicians such as attention deficit hyperactivity disorder and depression, ADHD, depression, in condition to absent-mindedness leading to an array of consequences affecting daily life. It can have more severe long-term problems. With this, with the other conditions of oculomotor nerves, sometimes it may affect with absent-mindedness. Memory loss. Some people are always feeling boredom. Why boredom? Why a person is boring, always boring and melancholic? We know that each and every day, morning, we should feed something for our mind. a new thing. A person is reading something in the morning time. Normally, we Christians are doing reading Bible, and some people may read newspapers in the morning. Some people may read some religious books. These changes, these make a person what he is. If one is reading newspaper in the morning, nowadays we know that everywhere not good things are happening, war and no peace. This time, I pray all of you to pray for a peaceful world in this Eid Mubarak day. A peaceful day. I greet all wishes all. A good, loving heart. And always, I told in the first time when I started the class that wisdom, the loss of wisdom is one of the main reasons for all these calamities. We all should have wisdom. If talking to a person having wisdom, how beautiful it is. Boring is happening because there is no feeding of good things in the morning hours. If we are morning hours, we are reading a newspaper, it may corrupt our mind. It may damage our thought process. It will put some unnecessary evil things into your mind. So I heard that on a psychiatrist in America, an important psychiatrist, he always prescribed the person to avoid or news fast for 1 week. Whatever the complaints, one person is coming to a psychiatric treatment, he says that you should news fast for 1 week. I did it. A few years back, not now, it is very old. One day I experienced it. I stopped reading for 1 week newspaper. My mind became very, I feel that a good peaceful. I got very much peace. That time it prolonged for 3 years. 3 years I never read newspapers in the newspapers. That time once I saw, I saw on paper, there is one person, a lady is, in that lady's eyes, there is one small thing. After reading that newspaper, I knew that a knife struck into her eyes. It is the end part of the eyes, the knife I could see. My mind was shattered seeing that. One news I read, another day, a mother and child eaten, soil and death, consumed, and death, suicide. So these are all getting from our newspaper. So getting evil news is not good. We should always feed our mind with new, spiritually enlightening things. In the morning, it may lead our day beautiful. Now let us go to the medical part. Aurum metallicum. This is an important medicine, very important medicine in eye complaints. Extreme photophobia, great soreness, higher potencies, 1,000 and more. Great soreness all about the eyes and into eyeballs. Double vision. Upper half of object visible, invisible. Feel tense, see fiery objects, violent pains in bones around eye. Interstitial keratitis, vascular cornea. Pain from without inward, sticking pains inward. Trachoma with fairness. So, or a met, the redness of eyes, we can also use this medicine. Double vision. Upper half of objects invisible. Then comes argentum nitricum. Eyes, inner candy swollen and red. Spots before the vision. Blurred vision. Photophobia in warm room. See? Photophobia in warm room. Virulent ophthalmia. Great swelling of conjunctiva. Discharge abundant. What is this? This medicine? Argentum nitricum. Virulent ophthalmia, great swelling of conjunctiva, discharge abundant and virulent. Chronic ulceration of margin of lids, sore, thick, swollen, unable to keep eyes fixed steadily. We should practice it. Steadily focus on a small dots. That will give, that is a good exercise for to avoid this condition. Unable to keep eyes fixed steadily, eye strain from swaying, worse in warm room, aching, tired, feeling in eyes, better closing or pressing upon them. This tiredness of eyes, ladies may have after 40 years, they have very much tiredness due to the hormonal imbalance during the time of menopausal period. That time, up to that time, they are doing things normally. But after that, the ages approaching to menopausal time, they may feel the same thing they cannot do as in their early time. It is not, nobody is asking them. Nobody is sharing them. They feel tiredness. So we have to understand that why it is happening. It is happening due to the menopausal syndrome. This medicine is useful in restoring power to the weakened ciliary muscles. Paralytic conditions of ciliary muscles, acute granular conjunctivitis, corneopath, and ulcer in cornea. Argentum. Nitric acid. Another medicine, double vision, sharp sticking pains, ulceration of cornea, gonorrheal ophthalmia, photophobia, constant lacrimation. Constant lacrimation, syphilitic arthritis. Another medicine, stramonium. Stramonium, eye seems prominent, staring wide open. Pupils dilated, cannot close properly. Loss of vision, complaints that it is dark and calls for light. Small objects look large. Small objects look large. Parts of the body seems enormously swollen, strabismus. That's, you know, the strabismus. All objects look black. Then, deadphemia. Ptosis, dropping of eyelids. Eyelids heavy, patient can hardly open them. Double vision. Disturbed muscular apparatus, corrects blurring and discomfort in eyes. even after accurately adjusted glasses. This is one of the main medicine we can use. Vision blurred, smoky, dim-sighted, people dilated and insensible to light, orbital neuralgia, these are in another medicine, hyoscyamus. These are all the diplopia and other. Okay. Hospital. Cataract with motor disturbances, inflammation of eyelids, sparse and spots before eyes, ptosis, vision impaired as if films were before eyes, paralysis of ocular muscles after exposure to cold. Let me finish. Thank you all.
Thank you, Dr. Hubert. It's really a very good session, and we need this kind of presentations to study mathematics in a different way. Congratulations once again. And with the time for discussion, Dr. Beatrice was always there. So let's begin from Dr. Beatrice.
Yes, thank you so much, Dr. Hubert. It was very, very interesting. And it's also, I feel it's also impressing how with the anatomy of the brain, there's so much knowledge. It's incredible. Could you please tell me the first remedy you have been talking about? I missed it. The second was argentum nitricum, but the first one, what was the name again, Dr. Hubert?
Pardon, I can't get in this class, sir. Whether in this
Yes,
class,
yes.
I am talking about the corpus callosum. Corpus callosum. Next day
No,
we can.
I'm talking about remedies now. At the end, you showed the remedies, and the first one I did not understand the name. The second one was
Aurum.
Interesting. It's very interesting to see the eye symptoms of the different remedies. It's would be very nice to study this more. And for me also very special. I've never heard this that the women in menopause are getting these problems. What we see, we have a lot of reading, we need some glasses after 40 years, but getting these eye problems, I've never heard. Thank you very much. This is interesting. Yes.
Thank you.
Yes. If anybody want to talk to Dr. Hubert, Rambaresu sir, do you want to speak? Yes, let us invite our guest, Mazlum sir, to say a few words on Dr. Hubert's presentation.
Thank you, Dr. Dhaneshi. Congratulations, Dr. Hubert de Silva. Everyone, namaskar. Very nice presentation, excellent session. Neurological disorder. Only optic nerve. So homeopathic treats neurological disorder through the individualized medicine and selection based of totality of symptom, and miasmatic understanding, miasmatic background. So very thanks. Lot of medicine, gelsemium, gelsemium, astumonium, casticum, neurological disorder, lot of medicine according to select remedy, symptomological. Thank you. Very thanks. Gargar homeopathic.
Yes. Now I'm inviting Dr. Binoy to say a few words, and you can make the auto thanks also.
Sure, Doctor. Dr. De Silva, it was a very nice session and very interesting. And you covered the anatomy of brain and mostly focused around the eyes and how they are connecting to the brain and the muscles around the eyes. I know those muscles are very key. And in yoga, there is particular exercises for those eye muscles that will rejuvenate the eyes and keep the vision more sustained and longer. And it was good to see that in your slides. And it was very, very interesting and a very enlightening session. Thank you very much. And I know you are going to have a follow-up session that will help. Maybe you will introduce some additional remedies that helps to improve the motor systems and the cognitive uh, effects. Thank you very much. Thanks from IFPS standpoint and all the doctors and the listeners in this session. Thank you very much, Doctor.
Thank you, doctor. Thank you, doctor.
Thank you, Binoy, Dr. Rambaray sir, Dr. Beatrice Gessner, and those who attend the session in this evening. And special thanks and congratulations to Dr. Hubert once again. Tomorrow we will have a session from Dr. Suraj Singh Bahodia, an assistant professor from Rajkot University, from Pearl University, Rajkot, from Gujarat. And we'll be talking about advanced pharmacy in homeopathy. There is something called advanced pharmacy. Let us see what is advanced pharmacy. So with that, we come to the end of the day, 2097. Thank you all. Good night. Over to Dr. Maria Maljon.
Dhanesh, doctor.